Bay Atikokan.
Thank you, Speaker. My question is for the Minister of Health. Our government was elected with a strong mandate to serve the people of Ontario. After years of neglect and disrespect from the previous Liberal government, supported by the NDP, Ontarians support us to make decisions that will make life better for everyone. This includes taking leadership to address affordability concerns and ensuring that our health care system receives the support that it requires. Unfortunately, our hospitals are having to deal with unnecessary rising operational costs thanks to increasing federal taxes, rising interest rates, and ongoing international supply chain issues. Hospitals across Ontario should be able to focus their resources on providing frontline services, not on taxes and red tape. Speaker, could the minister please inform the legislature about how rising costs from increasing federal taxes are negatively impacting our hospitals?
The Premier and Minister of Health.
To the member from Thunder Bay Atikokan for raising this very important issue. Since the federal government imposed a carbon tax, the financial burden is already making an impact on hospitals across Ontario. The federal government's carbon tax will impact Ontario's hospitals by increasing annual heating costs by $27.2 million for 2022. So what would that $27.2 million purchase? It would have offered an additional 104,615 MRI operating hours, providing scans for an additional 157 patients. These are real issues that are impacting our hospital partners and, of course, our patients. That's why our government will continue fighting the federal government's carbon tax on behalf of the people of Ontario.
And the supplementary question.
Thank you, Speaker, and thank you to the Minister for her response. While our government is advocating for all Ontarians, the opposition NDP and Liberals are oblivious to the far-reaching negative impacts that higher taxes and burdensome red tape are causing, among many other things they're oblivious to. When it comes to accessing specialized health care services, there are times when residents in Northern Ontario need to travel to other parts of our province. I know that many of my constituents rely on vital programs like the Northern Travel Grant that help offset long-distance travel costs. While with costs for fuel and accommodation continuing to rise, it is not right or fair that residents in the North should have to endure these additional expenses just because they need medical care and services. Speaker, can the minister please explain how increasing taxes and burdensome red tape are negatively impacting the people of Northern Ontario?
The Minister of Health.
And I would say the member is raising a very important issue that is actually costing all Ontario residents, but particularly our northern residents, to fill the car, heat your home, and feed your family. Even though our government is always looking at ways to make life more affordable, including looking at changes to the Northern Travel Grant to ensure it continues to serve Northerners in a way that is convenient and effective. We know the federal government is making travel more expensive. Over the last number of months, we have demonstrated the real cost of the federal carbon tax on families, on students, seniors, and on our institutions and services the people of Ontario come to rely on. We call on members from across the aisles to join us in demanding the federal government repeal this tax that is disproportionately impacting Northern Ontario.
The next question.